Hi and welcome. I'm trying to learn endocrinology, today diabetes, and after we've done that, we're going to do shoulder impingement training. And shoulder impingement is when the scapula is too much in front, and we're going to train to get the scapula further behind. And if you participate in that training for that, then that is at your own risk. Diabetes, we already later on part 2 diabetes. And it was that people who cannot control the blood sugar level have diabetes. And this often causes blood sugar levels to be too high, and so glucose passes out of the body in the urine. So we're going to talk here about diseases and also about urination. And to test that someone has too high that the glucose is passed out of the body can be tested through testing stripes. And another thing, we know that insulin is made in the pancreas, and that insulin comes then to the liver, and there it causes it to convert excess glucose into glucosamine for storage. I have a major problem. I thought it was only a little problem, but it seems to become a major problem. I'm not sure what excess means. To convert excess glucose, I don't understand the sentence. Excess means excessively, over the top. Causing it to convert excess glucose into glucosamine. I get it. Glucose into glucosamine, but it's another word I haven't read closely. So diabetes is often causes blood sugar levels to be too high, and so glucose is passed out. To convert glucose into glucosamine. Okay, what is happening? It is insulin is the hormone controlling it, and that insulin is given out by the pancreas. And there's too much glucose in the blood, and now the pancreas sends out the insulin to the liver, and the liver starts to do the excess with too much glucose into the glucosamine and stores it. Yes, that glucose is passed out of the body, so we have to look closely. There is a difference between glucose and glucosamine. Glycogen, glucose and glucosamine. So what I wanted to say is, I came across it. I had looked it up a couple of months earlier. The liver seems to be here, and the pancreas directly underneath. There are two types of diabetes. That's why we actually type 1. No, for diabetes. Type 1. Diabetes is a genetic disorder. Type 1 is a genetic disorder. It is caused by the pancreas failing to make enough insulin. The pancreas is making the insulin, and the insulin is the hormone which goes to the liver and controls there if the glucose should go into the blood or be done to glucosamine, and the glucose will pass out of the body. Whatever the problem is, that there's a genetic disorder with the pancreas, and the pancreas is not probably doing this insulin, which would stop the liver from putting this glucose into the blood. It is treated with regular insulin injections in order to control the level of glucose in the blood. People also need to control the diet carefully. Okay, it is treated with regular insulin injections. So we're going to talk now also about injections. Injections in order to control the level of glucose in the blood. So people are injecting insulin. These are insulin injections. In that injection is insulin. So these people are having a problem with the pancreas, and the pancreas by type 1 of diabetes. The pancreas is not doing the insulin, which would go to the liver and says to the liver, stop doing glucose into the blood, convert it into glucose, store it in yourself, or whatever you do, don't do it in the blood, maybe you just pass it out through the urine. And now the people getting an injection, I don't know where it comes in, and in that injection is insulin, and the insulin does not have a job, and the insulin comes through an injection, because the pancreas is not doing it. And these people also should control their diet. Type 2. Type 2 diabetes is caused by the cells of the body failing. You know what? That is enough. Type 1 is caused because the pancreas is not properly doing the insulin. The insulin would go through the bloodstream to the liver and telling to the liver, stop doing glucose into the blood, convert it into glucose, it's stored in yourself, or pass it out through the urine as glucose, whatever. The thing is, the pancreas is not producing insulin, which would tell the liver not to do glucose or blood sugar into the blood. And other people get an injection. with the insulin, and that insulin now comes from the injection instead of the pancreas. That is totally enough. If you were here for diabetes and you want to get more diabetes, and you can go directly to the next part and we continue talking about it. Now we're going to do the shoulder impingement training. If you participate in the shoulder impingement training, that's at your own risk. We're doing shoulder circuits. Legs go to stable, shoulder width wide apart, and we're going back, up, and front, and down with the shoulders. And again back, up, and front, and down. And now backwards and front, up, back, and down. And one more, front, back, and down. And now long arms, strong fists. And we're going as far back as we can with the shoulders. So high up as we can, as far in front, and down, and back, up, and front, and down. And now high up, and back, and down, and front, up, and back, and down. Next exercise, legs wide apart, we're going a bit into the knees, bending forward with a straight back, letting the arms hang, and we're pinching the scapulas together. And we're doing that with effort. Now my fists, with the arm ups, it's to pinch the scapulas together. With the arms on, and the scapulas, and another round, pinch the scapulas together with effort. Like fists, with the arm ups up, it's to pinch the scapulas together. With the arms down, the scapulas. And the second similar exercise, into the knees, pinch forward, the round back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring the arms together, straighten slowly up, bring the shoulders down, head together. The arms high up, head together, shoulders down, head together. And another time, into the knees, pinch forward with the round back, let the arms hang, make fists, and the fists to the inside, lift the arms high up, bring them together, straighten slowly up, shoulders down, head together. Arms high up, head together, shoulders down, head together. And the next exercise, we're doing slowly wide arm circuits. Go far back with the arms, high up, in the front, slowly back, and another round. Far back, reach also back, not just to the side, high up, front, actually across a little, and then we're changing the direction, in front, high up and back, not just to the sides but backwards. And again in front. High up to the sides and also back. And down. And one more shoulder circle backwards. And take the arm in, shoulders back and down. Pull the arm and have flat fingers. Try to relax the arm and go back with the shoulder. And the other arm in front, shoulders back and down, pull the arm and have flat fingers, try to relax your arm and go back with the shoulder. And bit pose the shoulder training. I thank you very much and until next time.